the doctor is in this morning. That's because February is American Heart Month. According to the CDC, heart disease is a leading cause of death for men, women, and people of most racial and ethnic groups in the U.S. In 2022, 1 in every 5 deaths in the United States were caused by heart disease. We're joined now by Dr. Paul Saunders. He is the chief of cardiac surgery at Maimonides Hospital in Brooklyn, Maimonides Health. Great to have you with us this morning. Before we talk about general things about heart health, let's talk about the work you do at the Left Ventricular Assist Device Program, specifically what you do there in this program.
So we, at Maimonides, we run a multidisciplinary program for patients with advanced heart failure with surgeons like myself, board-certified cardiologists, and advanced practice nurses. We offer the broad spectrum of treatment options for patients with advanced heart failure. One of those options is the implantation of left ventricular assist devices. The left ventricular assist device is a treatment option for patients with end-stage heart failure where medical therapy is no longer enough. It's a surgically implanted, electrically powered pump that actually is implanted inside the heart in the main pumping chamber of the heart. And it basically augments the heart function to allow patients to return back to a more normal life and avoid hospitalizations.
And you have an example?
I do, yes. So this is the
LVAD.
This is the LVAD, left ventricular assist device, the HeartMate 3. It's the pump we've been using for the last almost 10 years.
So this is common in cases that are more severe cases?
Yeah, this is sort of end-stage patients with end-stage heart failure where medical therapy alone is not enough.
So Maimonides Health has the only LVAD program in Brooklyn. Talk to me about accessibility. That's always an issue when it comes to health care.
Yeah, for patients around New York, obviously access to good quality health care is a real issue, especially in the outer boroughs. So we're proud to provide the only real full spectrum heart failure center in Brooklyn. Patients with advanced heart failure need a lot of very advanced medical care and a lot of close follow-up. It's very hard to do that when you're very far away from your center. So we like to provide this care much closer to home, closer to families, much easier on the patients and the families.
Again, with heart disease so prevalent now, describe sort of the demographics that you see come out in and out of your hospital, some of your patients. Has that changed over the years? What do you see now?
We see patients of all walks of life, and because of the socioeconomic nature and the health aspects in Brooklyn, we see a lot of patients with advanced heart failure where hypertension, diabetes are very prevalent and really out of control in big parts of our borough.
Let's talk about some of the symptoms of heart failure. That's very important. I'm going to put those up on the screen. We can talk over some of them. Some of these people, of course, know about shortness of breath during daily activities, trouble breathing when lying down, weight gain with swelling in the feet, legs, ankles, generally feeling tired or weak. When we look at those, high blood pressure, of course, anything specifically stand out to you that you really want to reinforce?
Yeah, well, so the symptoms of heart failure can really start insidiously. So usually exercise intolerance. So, someone who can easily walk 5 blocks now can only walk 1 block without being fatigued, tired, short of breath. Eventually, as the disease progresses, patients can be so symptomatic they can only barely get out of bed or can barely do their normal activities of daily living. When patients have reached that stage, they really need to be seen in the advanced heart failure, by an advanced heart failure team.
And sometimes people ignore these signs and symptoms. They think they're having an anxiety attack. They're not sure. Unfortunately,
especially in younger patients, a lot of these things are ignored or misdiagnosed for a long time. And then when the patients do actually make it to treatment, or to assessment, they're really very far gone.
So better to be safe than sorry,
Absolutely.
Of course, especially when it comes to your health and especially your heart. It's okay, let's talk about some tips about maintaining good heart health. Choose healthy food and drinks, of course, a healthy weight, regular physical activity, don't smoke, check your cholesterol, blood pressure, of course. Some advice as we look over these and to tell some of our viewers about.
Well, when we talk about heart disease, we talk about modifiable and not modifiable risk factors. So things that are genetic risk factors, like family history of heart disease, whether you're born as a diabetic or whether you may have hypertension, those are things that you can't really do much about. Now, you can obviously treat them as you have them. Control your sugar if you're diabetic, control your blood pressure if you have hypertension. Obviously, you can't pick your parents, so you can't adjust your genetic history. But then other modifiable risk factors, things like avoiding smoking, healthy diet, lots of exercise. We recommend avoid excessive alcohol, those sorts of things.
And in terms of getting screened, what is your advice there?
Well, I mean, know your blood pressure, know your numbers, stay in touch with your regular physicians. Those sort of things are really hallmark.
Yeah, on a pretty regular basis. Dr. Paul Saunders, a pleasure to talk to you this morning. Really do appreciate it. Happy Heart Month.
Thank you.